1 in 3 American adults is at risk for kidney disease. Last week, a patient told me something I'll never forget. She said, "Dr. Gulden, I'm more afraid of my kitchen than I am of my diagnosis." That's what I want to change today. Let me say that statistic again. 1 in 3. That means if you're watching this with 2 friends, statistically, one of you will face kidney challenges at some point. But here's the good news. What you eat can make a profound difference. I'm Dr. Maria Gulden. I've been working with kidney patients for 25 years, and I've watched thousands of people navigate the confusion of kidney-friendly eating. Today, I want to show you something clear and practical. 17 foods, some that protect your kidneys, some that don't. No confusion, no overwhelm, just straightforward guidance that you can use starting today. Whether you're at stage 1 chronic kidney disease, or CKD, spelled CKD, or stage 4, whether your creatinine, pronounced creatinine, is just starting to climb, or you've been managing this for years, this information matters. Let's talk about what actually works. Before we dive in, let me tell you why I'm making this video. Last month, I met a woman named Margaret, 68 years old, stage 3 kidney disease. She came to my office carrying a folder full of printouts from 12 different websites, each one telling her something different. One site said bananas were fine. Another said they were dangerous. One said milk was essential. Another said to avoid dairy completely. Margaret looked at me and said, "Dr. Gulden, I'm so afraid of eating the wrong thing that I barely eat at all." That broke my heart. Because here's what I know after 25 years in this field. The kidney diet doesn't have to be that confusing. Yes, it requires some changes, but you can absolutely eat well, enjoy your food, and protect your kidneys at the same time. The challenge is this. When your kidneys struggle, they can't filter certain things as effectively. Potassium builds up. Phosphorus, pronounced phosphorus, accumulates. Sodium affects your blood pressure. Protein becomes harder to process. So we adjust. We choose foods that give your kidneys less work while still nourishing your body. Think of it like this. Your kidneys are 2 hard-working employees who used to handle everything with ease. Now they're getting tired. They still work, but they need you to organize the workload differently. You don't fire them. You don't panic. You just give them tasks they can handle. That's what kidney-friendly eating is. And here's what matters most. This isn't about perfection. It's about direction. Small, consistent choices that add up over time. Margaret learned this. Within 3 months, her confusion turned into confidence. Her creatinine stabilized. She stopped being afraid of her kitchen. That's what I want for you, too. So let's make this simple. When kidneys are damaged, 4 things need attention. Number 1, sodium. Picture salt tightening your blood vessels like squeezing a garden hose. More pressure, harder work for your heart and kidneys. When kidneys struggle, sodium builds up. Blood pressure rises. Swelling happens. We want less than 2 grams of sodium per day. That's about 1 teaspoon of salt total. Number 2, potassium. For healthy kidneys, potassium is great. But when kidneys are damaged, they can't remove excess potassium from your blood. It accumulates and affects your heart rhythm. So we limit it to around 2 grams per day for stage 3 and 4 kidney disease. This is hard because potassium hides in foods we think are healthy. Bananas, oranges, potatoes, spinach. Number 3. Phosphorus. Phosphorus works with calcium to build strong bones. But when kidneys fail to remove it, your body pulls calcium from your bones to balance things out. The result? Weaker bones, even though you're eating foods you think are helping. We limit phosphorus to less than 1 gram per day. Number 4. Protein. Protein is essential. But when kidneys break down protein, they create waste products. Specifically, urea. Struggling kidneys can't keep up. The waste accumulates. You feel tired, nauseous, weak. So we adjust. Not eliminate protein, but choose the right amounts and the right types. Now here's what you need to understand. These 4 restrictions only apply when your kidneys are damaged. If your kidneys are healthy, eat your bananas. Enjoy your spinach. But if you've been told you have chronic kidney disease, if your creatinine is climbing, then we pay attention to these 4. The stage matters too. Stage 1 and 2, we focus mainly on sodium and protein. Stage 3 and 4, all 4 restrictions become important. Stage 5, when dialysis is needed. The rules actually relax because the dialysis machine does the filtering work. But our focus today is stages 1 through 4. The time when food choices make the biggest difference. Once Margaret understood these 4 principles, everything else made sense. Let me show you how this plays out in actual food choices. Let's start with what you can eat. 10 foods that form your daily foundation. Number 1. Cauliflower. Low in sodium, potassium, and phosphorus. High in vitamin C, vitamin K, and fiber. You can eat it raw, steamed, roasted, or mashed as a potato substitute. Number 2. Berries. Most fruits have high potassium, but berries are the exception. A cup of strawberries has only about 150 milligrams. They're loaded with antioxidants and taste like a treat, not a medical diet. Number 3. Fatty fish. Salmon, tuna, halibut. They provide high-quality protein that's easier on kidneys than red meat. The omega-3 fatty acids help reduce inflammation and support heart health. Keep preparations simple. Grilled, baked, or steamed. Skip the salt and breading. Number 4. Red grapes. Low sodium, reasonably low potassium at 144 milligrams per cup. They contain resveratrol, which may protect kidney cells. Number 5. Egg whites. Egg yolks are high in phosphorus, but egg whites? Pure kidney-friendly protein. 2 large egg whites give you 14 grams of protein, with almost no potassium, phosphorus, or sodium. Number 6. Garlic. Your flavor hero. When you're cutting back on salt, garlic changes everything. It's aromatic, flavorful, and brings vitamin C and anti-inflammatory compounds while staying low in what we're monitoring. Use it as your salt alternative. Number 7. Cabbage. Another low-potassium, low-phosphorus vegetable. High in vitamin K, vitamin C, and fiber. Eat it raw in coleslaw, sautéed, steamed, or as kimchi if you skip the high-salt preparation. Number 8. Skinless chicken breast. Lower in phosphorus than dark meat. Lower in potassium than beef. The key is preparation. Plain baked chicken is kidney-friendly. Fried with breading and seasoning salt is not. Number 9. Red bell peppers. Remarkably low in potassium at 156 milligrams per cup. Extraordinarily high in vitamin C. One small pepper gives you more than your daily requirement. They add color and crunch without adding stress to your kidneys. Number 10. Olive oil. Almost zero sodium, potassium, and phosphorus. Your healthy fat source that you can use freely. Picture your breakfast tomorrow. Fluffy scrambled egg whites, diced bell peppers, fresh garlic, blueberries on the side. Drizzle of olive oil on whole grain toast. That's a kidney-safe breakfast that looks and tastes like real food. Now here's something that surprised me. I had a patient named Susan who'd been avoiding all fruits because she was scared of potassium. When I showed her that berries were safe, she actually cried. She said, "You mean I can have strawberries again?" The joy on her face reminded me why this matters. It's not just about numbers on a lab report. It's about the small pleasures that make life worth living. Susan now keeps a bowl of mixed berries in her fridge at all times. Let me show you 7 more foods that can bring that same kind of joy. Number 11. Onions. Like garlic, your salt alternative. Low in potassium, high in vitamin C and B vitamins, with prebiotic fibers for gut health. Number 12. Arugula. A peppery salad green that's low in potassium, but high in vitamin K and calcium for bone health. Number 13. Macadamia nuts. Most nuts are high in phosphorus, but macadamia nuts are the exception. They are low in phosphorus while providing healthy fats and B vitamins. If you want nuts, this is your best choice. Number 14. Radish. Low potassium, low phosphorus, high vitamin C. Those crisp, peppery slices add fresh bite to salads. You can also roast them, and they become mild and sweet. Number 15. Pineapple. Most citrus is off limits, but pineapple sits at about 180 milligrams per slice and is considered safe in moderation. It contains bromelain, an enzyme that may help with inflammation. Number 16. Cranberries. Particularly good for kidney patients because they help prevent urinary tract infections. They contain compounds that stop bacteria from sticking to the urinary tract. Low in potassium and phosphorus. Number 17. Shiitake mushrooms. White button mushrooms are high in potassium, but shiitake are lower. They provide plant-based protein, B vitamins, copper, and selenium. These 17 foods are your foundation. Picture dinner tonight: baked salmon with garlic, roasted cauliflower with herbs, a small portion of white rice, and 3 slices of fresh pineapple to finish. That's a full meal that's both kidney-friendly and genuinely satisfying. Now let's talk about what to avoid. There are foods that need to be limited when kidneys are struggling. Let me group them into 3 main categories. Category 1. High potassium foods. Bananas, oranges, potatoes, tomatoes, spinach, kale, avocados. All incredibly nutritious for healthy people. All problematic for kidney patients. One small banana has 400 milligrams of potassium. A medium potato has nearly 1,000. When your limit is 2,000 milligrams for the whole day, these eat up your allowance fast. Category 2. High phosphorus foods. Dairy products like milk, cheese, and yogurt. Most nuts except macadamia. whole grains like brown rice and whole wheat bread, dark-colored sodas. The irony with dairy? We eat it for strong bones, but when kidneys can't filter phosphorus, it actually weakens bones. Whole grains are normally healthier than refined, but for kidney patients, white rice is better than brown, white bread better than whole wheat. Dark sodas contain phosphoric acid. Even diet versions have the same problem. Category 3. High-sodium foods. Processed and packaged foods. Anything canned, frozen with sauce, pre-seasoned or pre-made. Deli meat, hot dogs, frozen dinners. Pickled and cured foods like pickles, olives, and sauerkraut. One pickle can have 400 to 800 milligrams of sodium. That's half your daily limit. Does this mean you can never have these foods again? Not necessarily. Talk to your nephrologist, check your blood work. See where your levels actually are. Some people at early stages can handle small amounts. Others need to be stricter. But knowing these categories helps you understand why your doctor might tell you to avoid foods that seem healthy. Let me tell you about Tom. 71 years old, stage 2 kidney disease. He came to me frustrated. Tom loved his morning orange juice, his mid-morning banana, his sweet potato with dinner. All foods he thought were healthy. Then he got his diagnosis. His first reaction was to stop eating almost everything. Plain chicken and white rice, afraid of making things worse. Within 2 weeks, he'd lost weight and felt weak. His wife called me worried. We made a meal plan using the 17 foods I've shown you today. Breakfast became scrambled egg whites with bell peppers, berries instead of orange juice, cauliflower rice with dinner. The first week he found it boring. The second week he started experimenting with garlic and spices. By the third week he said, "I thought eating for my kidneys meant eating like a sick person. Now I realize it just means eating a little differently." 6 months later, Tom's creatinine was stable. His potassium was normal. His blood pressure improved. He didn't feel deprived. He felt in control. And that's the shift I want for you. This isn't about restriction as punishment. It's about choice as protection. You're not giving up good food. You're choosing food that lets you feel good. Tom adapted. He thrived. And so can you. Before we finish, I need to be clear about something important. Everything I've shared today is general guidance. Your specific situation is unique. This video is not a replacement for working with your nephrologist. Use it as a starting point. Use it to ask better questions. But then sit down with your kidney doctor. Show them your labs. Get personalized advice. Let me answer the most common questions. What if my potassium is still normal? If you're at stage 1 or 2 and your potassium is consistently normal, your doctor might say yes to small amounts of higher potassium foods. But check first. What if I'm vegetarian or vegan? Yes, you can still follow this, but it's harder because many plant-based proteins are high in potassium and phosphorus. Work with a renal dietitian who understands plant-based eating. What about supplements? Never take supplements without talking to your doctor first. Some vitamins that are fine for healthy people can be problematic for kidney patients. When should I seek medical help immediately? If you experience severe swelling, confusion, difficulty breathing, irregular heartbeat, extreme weakness, or significant changes in urination, seek help immediately. These are signs that kidney function may be declining rapidly. Diet helps. Diet matters. But diet is one piece of comprehensive kidney care. You need medical monitoring. You need lab work. You need professional guidance. What I'm giving you today is education, knowledge, a framework for understanding. Take this knowledge to your doctor. Let them help you apply it to your specific situation. Your safety matters more than anything else. Let me bring this together. Kidney disease changes what you eat, that's true. But it doesn't have to eliminate joy from eating. 17 foods we talked about today: cauliflower, berries, fatty fish, red grapes, egg whites, garlic, cabbage, chicken breast, bell peppers, olive oil, and 7 others. These become your foundation. 3 categories to limit: high potassium foods, high phosphorus foods, high sodium foods. 4 substances to monitor: sodium, potassium, phosphorus, protein. One principle underneath it all: match your food choices to what your kidneys can handle right now. Margaret went from overwhelmed to confident. Susan rediscovered the joy of berries. Tom went from restricted to empowered. You can too. This isn't easy. I won't pretend it is. Changing how you eat requires effort, planning, and some trial and error. But it's worth it. Every meal that supports your kidneys is a meal that protects your future. You're not doing this because you have to. You're doing this because you can. Because you have agency. Because small, consistent choices add up to significant protection. That's powerful. You have more control than you might think. If this video helped clear up confusion about kidney-friendly eating, I'd be grateful if you'd subscribe. When you subscribe, YouTube shows these videos to more people who need them. Someone else out there is confused about what they can eat right now. Your subscription helps them find this information. So if you found this useful, hit that subscribe button. Also, if you know someone managing kidney disease, share this video with them. Send them the link. Help them find clarity. Next week, I'll talk about managing blood pressure naturally when you have kidney disease, a topic that goes hand in hand with what we covered today. Until then, take care of those kidneys. They're working hard for you. I'm Dr. Maria Gulden. Thank you for watching.